ChatGerry, explanation for my blood pressure, monitoring results and why I request a medication adjustment, number 1447, November 25, 2025, Gerald C. EclaireMD Foundation. Category, Stroke, and Hypertension Medication. Preface, I wrote this short article as a personal note, after surviving a hemorrhagic stroke in the pons area on June 21, 2025. It is not a formal research paper, but it contains practical observations that may help others. I discuss the value of big data, why outliers matter more than averages in stroke cases, and why diabetes and hypertension play very different roles in stroke causality. For these reasons, I decided to record my findings, and keep them in my research files. Background information. My goal is simple: prevent a second stroke. The pons is one of the most dangerous locations for a brain bleed. Published studies show a mortality rate of from 40 to 80%. I was lucky to survive once. I cannot depend on luck again. To protect myself, I built a complete blood pressure analysis system on my iPhone using mathematics, physics, engineering, and AI algorithm design. I measure my blood pressure 16 times each day. Over the past 140 days, I collected 2,240 measurements, equal to more than 11,000 data points. My system tracks 5 biomarkers: SBP, DBP, HR, PP, and MAP. It also detects patterns, spikes, and geometric drift, using my viscoplastic energy model and topological geometry analysis. My stroke was caused by a one-time BP spike at 175 mm of mercury, not by an average. Averages do not rupture vessels. Spikes do. Therefore, I focus on early warning signs, especially small upward drifts in SBP pattern. During July to September, 90 days, I had 3 events where SBP reached from 140 to 149. During October to November, 50 days, I had 7 events in that same range, a 133% increase. Events in the from 130 to 139 range also rose from 20 to 80, by about 400%. Even though the absolute numbers are small, averages are low. But the upward trend is clear. My SBP drift is rising. As a stroke survivor with irreversible vascular calcification, this is dangerous. My vessel calcification was formed mostly between 1990 and 2009. During my uncontrolled diabetes period, medications only without any efforts on lifestyle management. About 91% of the vascular calcification damage occurred during those 20 years. The remaining 9% formed between 2010 and 2025. Strict lifestyle control without any medication. Calcification at the cellular and microstructural level cannot be reversed by lifestyle changes or any modern medications. Because I cannot repair the old damage, prevention is my only strategy. Medication discussion. I asked my primary physician whether increasing my BP medication might reduce my risk. After reviewing my data, she agreed. Her instruction is: increase amlodipine from 2.5 mg daily to 5 mg daily. Continuously monitor my BP closely. If the average SBP drops below 110 mm of mercury, or if I develop dizziness or weak legs, reduce the dose back to 2.5 mg. Do not throw away the 2.5 mg bottle because I may need it again. She also agreed that acute BP spikes are far more dangerous for me than average BP values. However, the main risk of taking 5 mg is hypotension, which could lead to falling and injury. Looking forward, during the next 90 days, I will collect another 8,640 BP readings with 1,440 SBP data points. This will give me a deeper understanding of my SBP drift pattern. If my SBP becomes too low, I will immediately return to the 2.5 mg dosage. Disclaimer: I write this article not for fame, but to share what I have learned so others can understand their health, prevent disease, and live longer, healthier lives. This content is for educational reference only and is not medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered or republished as your own. All rights belong to the author, Gerald C.